All right, hello, everyone, and thank you for joining our webinar today, The Future of Telemedicine on Virtual Primary Care. We're just going to give everybody a few more minutes to get logged in, and then we'll get started here at about 2:02, 2:03. All right. Now giving folks a couple minutes to get logged in. I think we'll have a few more stragglers, but probably makes sense for us to go ahead and get started. So hello, and thank you everyone for joining us today. As I said, our webinar and presentation today is in partnership with MeMD, and I'm excited about today's topic of discussion because I believe we're having a real moment in healthcare that we can look back on 5, 10, 15 years from now as a point and point to as a real catalyst for some much needed change in the industry. There's many reasons that I think we'll see this change from a delivery of care to the way that we interact with the healthcare system as consumers, to the emphasis we place on actual components of the overall healthcare strategy as employers. And really during the pandemic, much has been made about the explosion of telemedicine and other types of virtual care. But telemedicine isn't really new to us or to anybody else on the phone, likely. And in fact, many of us have probably been emphasizing the importance of virtual care for years. But now that it's being more widely adopted and utilized, and the spotlight is sort of on telemedicine, the question we want to talk about and answer today is really where do we go from here? And how do we think about making telemedicine more powerful, really as a tool to create healthier Americans, as well as a tool to reduce healthcare costs? So today we're going to take a look at the next evolution of telemedicine as we dive into really this concept of primary virtual care. So with that, I'll go ahead and introduce our speakers for the day. So I'm Rob Lehane. I'm the CEO of TouchCare, a premier white glove healthcare concierge service for employers. And today I'm excited to be joined by Dr. Nicholas Renzo and Bill Goodwin, the Chief Medical and Chief Executive Officers from MeMD. MeMD is one of the nation's largest and most complete providers of telemedicine services, from virtual urgent care to virtual therapy to men's and women's health programs. MeMD has really over the years been at the forefront of more relevant and robust consumer offerings, and today is going to walk us through their new virtual primary care offering, which we expect to be and expect to change the face of telemedicine for the future. So Dr. Lorenzo and Bill, great to have you, and thanks for spending some time with us.
Well, thank you very much, Rob, and it's great to be with all of you here today, and we appreciate you giving us some of your very valuable time to learn about what is a very exciting product, virtual primary care. As Rob alluded to, COVID-19 has moved virtual care forward at least 5 years, if not more, in the last 7 to 8 months, and has put it in the forefront of healthcare delivery in America. And so because of that, the concept of virtual primary care has really come to front and center and we are excited to be able to talk to you about our offering in this arena. And so why this, in fact, is important is because there has been a population shift in America that will see about 20% of the US population over the age of 65 by the year 2030. And that's because of the generation that I'm at the tail end of, the baby boom generation. 75 million plus of us are all getting older. And in fact, 10,000 people a day, pretty amazing, turn 65 in America and become eligible for Medicare. And on top of this, there's an increased complexity of the healthcare system. Believe it or not, the amount of information within healthcare doubles about every 18 months. Yes, that's right. Every 18 months, the amount of information doubles in healthcare. And because of this and this increased complexity, healthcare insurers spend $4.8 billion annually on administrative costs, among other things. And so this is a very important complicating factor in the delivery of healthcare. And also, prescription drugs are a major treatment in America, as we all know. 2/3 of Americans are on prescription drugs. And this is because primarily of chronic disease. And chronic disease accounts for almost 9 out of every $10 spent in US healthcare. I'll say that again, almost 90% of all the money we spend on healthcare in the United States every year, about $3.5 trillion annually, is spent on the diagnosis and management of chronic disease. Pretty amazing, amazing statistic. And so to the next slide, please, where we talk more about chronic disease. And it probably won't surprise you to know that about 60% of Americans have a chronic disease, and 4 in 10 of those people have 2 or more chronic diseases, and these numbers will only climb as the population ages, because obviously chronic disease prevalence increases with age. One other issue that we sometimes don't give enough attention to is that 42% of the US population is obese. And what does that actually mean? 42% of Americans are about 30 pounds or more overweight. And even scarier, about 30% of Americans are morbidly obese, which is about 50 pounds over ideal weight. And this is a major issue because obesity is linked to more than 60 chronic diseases, not only the obvious ones like diabetes and heart disease and high blood pressure, but in fact, over the last 7 months, we have uncovered that obesity is an independent risk factor for poor outcome in COVID-19. So not just being older and obese, but just being obese in and of itself portends for a less optimal outcome in COVID-19. So this is just one more reason why the obesity epidemic in America is so critical. Next slide, please. And so I want to really emphasize again this particular fact with you, that 90% of our nation's $3.5 trillion annual spend in healthcare is spent in diagnosing and treating patients with chronic and mental health conditions, and that virtual primary care is a major plus, is a major advance in our ability to deal with this ever increasing and more severe problem. And now I'll turn it back over to Rob, I believe.
Yep, great. Thanks, Dr. Lorenzo, and that sets us up nicely. And just to keep exploring, how this dynamic has really played out in the healthcare strategy of employers, we've seen so many strategies kind of come and go over the last 20 years that simply put have not worked to control costs, right? So today you have a situation where employers and employee costs are both at all-time highs. We have an access problem. We have a cost transparency problem in our healthcare system that places a drastic amount of pressure on consumers to be effective shoppers. But we also have a consumer base that's confused and somewhat uneducated, right? And we have a stat in here. It's one of my favorite stats. 96% of Americans cannot accurately define coinsurance, copay, deductible, and max out of pocket. And so, at some point, the cost of care and the confusion and the lack of transparency, it all sort of adds up to folks delaying or not receiving the medical care that they need, whether that be due to care or due to cost or due to the fact that they just simply can't figure it out. So as we sort of settle into what healthcare will look like moving forward, we're predicting a few things that will have, sort of used COVID, as I mentioned before, as a sort of catalyst for change in the employer market. And so as we look at these trends in healthcare and sort of predictions that we're making, so first of all, we believe that employers are going to place an emphasis on diagnostics in a way that they never have before, and testing and understanding the health and really the individual health of their employees and their family members. And with over 170 million Americans receiving healthcare through their employers, we've always seen that any sort of cost controls and innovation needs to be driven by the private sector. And with COVID, we think that employers need to really change their way of thinking around the safety of their workplace, their employees, their visitors, and are really going to place a wholly new and renewed focus on diagnostics and testing for employees as a way to better understand health and better structure the health programs for their employees. Second, the emphasis on virtual care as a way to create access for consumers is absolutely here to stay. And this was, from an adoption sense, really forced upon us earlier this year when the pandemic made more people comfortable with and created more dialogue around the need for virtual services, even though most of us on this presentation really have already known it was there and needed to be more focused on and more emphasized. Utilization wasn't necessarily there. So specifically, I think we're going to continue to see a big rise in virtual services, and even more specifically on virtual services that really do break down access problems that we have in this country around, especially behavioral and mental health, which are going to start to play a much larger and much more significant role in employer health plan strategy moving forward. And then last, what we're here to talk about today is a move towards virtual primary care. So a move away from, not necessarily away from, but a move from a more reactive telemedicine virtual world and into a more proactive virtual primary care setting, which can help to engage folks in regular primary care, which is absolutely the most proven way, the most proven effective way to manage one's health, right? And so there's a problem in America that we've seen over the last 10 plus years of Americans decreasingly engaging with primary care physicians. And in just a minute, we're going to hear from Bill Goodwin, the CEO of MeMD, about how we can change that to create healthier consumers and ultimately reduce cost. And so before we jump into that real quick, we just wanted to share some of the insights that we've seen in telemedicine adoption and utilization before the pandemic that we keep sort of hinting to and mentioning, but it's really quite staggering. I mean, by mid-April, almost 70% of all visits were being done virtually. And even since then, as we've sort of returned into somewhat of a more normal or in-person reopening of physicians' offices and healthcare systems, we've seen that number hold strong around 20%, which is up from, traditionally speaking, around 1% utilization, if that, in the pre-pandemic world. So that, combined with a really strong interest from employers and healthcare providers to provide more virtual care and to break down access problems and to provide more comprehensive health solutions and more proactive health solutions to their employees, we think is going to lead to more adoption, more innovation, more utilization as we move forward. And that's really what virtual primary care is all about. So with that, Bill, I'll turn over the next section to you.
Great, thanks, Rob. Thank you, everybody, for taking your time this afternoon. So, before I jump into the offering, I just want to kind of do a quick little recap on what Rob and Dr. Lorenzo have alluded to. So you have an aging population, coupled with the fact that a lot of the people in the workforce are millennials or younger who would prefer to consume everything through technology or virtually. You have prescription drug prices escalating. We don't see any end to that happening. As Dr. Lorenzo talked about with chronic disease, you can walk through any shopping mall or any grocery store and look around, unfortunately, and you can see a snapshot of what's happening across the US. You also have a shortage of primary care physicians that will grow to 55,000 in 10 years. And when you do the math, that means even getting into an in-person primary care physician is going to become increasingly difficult. And as Rob alluded to before COVID, costs were going up for healthcare at a much faster rate than inflation. And then COVID hits. And what does COVID do? Well, COVID drove both patient and provider adoption like crazy over the last 6 months. So not only have patients, most of us have all now had a virtual visit, but providers have started to do it and they like it. Mental health issues have come to the forefront because of the stress, anxiety that people are already under. That's been exacerbated and has also increased right now because of COVID. No one now wants to go into a waiting room, or would prefer not to go into a waiting room if they could avoid it. And then I think many of your clients and many of us are seeing that healthcare costs for next year, for 21, are going up 5 to 50% or more. If you're an employer or an employee, you're troubled with this dilemma of, my goodness, my costs went up again. So when you put all those together, you start seeing that something has to change. And at MeMD, we've been very focused on how do we take virtual care and do it to favorably impact care, but at the same time, favorably impact costs for both employers and employees. So next slide, please. You look at then, you add into that 41 million people don't have a primary care provider, adults. It's a very large number. And of the ones that do have primary care, a lot of times they don't go because it takes too long, either to get an appointment, I had to wait 2 or 3 weeks, or I can't spend 2 or 3 hours out of the office or away from my family. It's just not feasible to be able to do that. And we know one other very important fact, that for every dollar spent in primary care, that reduces the cost downstream of healthcare by $13. So if we can remove the barriers to primary care, if we can make it easier, it's going to help by over 13 times in terms of long-term costs. That's good for employees. That's good for employers as well. Next slide, please. So I'm going to cover this from 2 perspectives. The MeMD virtual offering. I'm going to cover it from both an employee vantage point and then the employer vantage point, because quite honestly, if you don't have really good benefits for both those parties, then the virtual care won't be consumed by anybody. So what I'll do first is I'll cover employee, and the key things you have to have from an employee perspective. It's got to have cost savings, it's got to have convenience, it must improve access, and it has to provide that connection with the care team. So next slide, please. So let's talk about cost savings. What have we done from a cost savings for the employee? Well, one is we want to remove the cost barrier. Every time you have to spend $40 or $50 or $75 on a copay, or maybe you're on a high deductible plan, by having a $0 or low dollar visit fee, we can remove that barrier, which will help more people go get care. The second component is prescription discounts. I looked it up again this morning. 46, almost 47% of the adult population was on a prescription in the last 30 days. Now, couple that with chronic conditions, and you know that isn't just for 1 month, it isn't just antibiotics, it's a lot of cholesterol and high blood pressure medication people are consuming. Those costs keep going up on prescription drugs. So we bundled in prescription discounts to help the employee. The next component is intelligent referrals. We all know that at some point in care, you have to go to a specialist for a variety of reasons. It could be a neurologist, it could be a cardiologist, it could be an orthopedic surgeon. So let's take an example here of how do you right now find out who is going to be the best provider for the best overall cost? It's really very difficult to do that right now. Well, not anymore. So what we do is we leverage billions of records of claims data as well as outcome data, actual quantifiable outcome data, so that when somebody does need to go to an in-person care option, and let's use, for example, a cardiologist, maybe the continued heart problems, the primary care doctor says you need to get checked out, they get referred to a cardiologist, we can serve up to the patient cardiologists that are available in their plan, that should there be a procedure, not only will the overall cost be the best, but it will be the best outcome. Because we have to remember, with any procedure, you're also trying to manage the long-term outcome, not just the cost of that exact procedure. Here's what we know for a fact, that 10 facilities here in the Phoenix area do not all charge the same price for putting a stent in. We also know 10 cardiologists don't all have the same high outcome data. So through that intelligent referral program, we're able to help make sure that we position people and give them options that are well suited in the plan that help both the employee and the employer from a cost standpoint. Now, in connection, one of the big barriers to care is how can I have the right level of connection with a team and a doctor that support me? So we have a dedicated care team that helps somebody manage their care. We also make sure that somebody can see the same virtual primary care physician when they need to do it, and do it quickly, usually within 24 hours, not 2 or 3 weeks. And then God forbid, maybe they don't like their primary care physician. We have others easily switch those records over, and then that person has that continued care as needed for their concerns. And then the last thing is on-demand chat 24/7. We all know that, quite frankly, a lot of times the issues you have or the questions that you need answered don't happen between 8 to 5. So from that, we have on-demand chat as well as the care navigation team available 24/7 to make sure people can put their mind to rest and get those questions answered. We now look at access, and that's critical. Continuity of care, I think, as we all know, is essential. You need to have somebody who can help manage your care over time. And by making it virtual, by making it have it easy to get to, and then having that primary care provider, as well as our care team, help somebody navigate their care over time, we're able to make sure there's a high continuity of care, which in turn lowers cost. Through our national partnerships with LabCorp and Quest, and also with imaging groups, we're able to have easily accessible lab work and imaging. I know even for quite a few of the groups, we're including the annual wellness labs in the price of the program, which makes it easy. It eliminates that barrier in terms of going to get your annual wellness visit. And then lastly, as both Dr. Lorenzo and Rob alluded to, chronic care management is critical. Make it easy for somebody to talk to their doctor and manage those conditions. And then the last thing is convenience. No surprise to anybody here. We live in a society and time where I want what I want now. And if I can't get it now, I may not get it. So we got to make sure we provide care on individual schedule. We have to make sure that they can see their VPC soon, not in 2 or 3 weeks. And we absolutely have to make sure that when they have an immediate issue, they can access an urgent care doctor within 10 minutes, 15 minutes, 5 minutes to treat that condition. So we've covered it a little bit from the employee standpoint. Now let's look at it from the employer. So the employer, equally so, you've got to help them decrease healthcare costs. You've got to provide greater inconvenience and flexibility. You also have to tap into the needs of the changing workforce, which we've hit pretty hard here. And then we have to look at how do we increase productivity and engagement as we go forward. So on the next slide, when you talk a little bit about cost containment, a virtual program can help both fully insured, self-insured, even groups with uninsured population manage healthcare costs. So how do we keep claims out of the health plan? How do we have a visit that costs, let's just say $50 versus $150 or $250? That's the power of virtual care. By doing this, for self-insured, we can keep claims out and overall lower their overall expense. And for a fully insured program, we can help them keep their renewals down in the future and manage the overall health costs in a much more constructive manner. From a referral standpoint, we talked about that. No surprise there for an employer. Well, if it's a lower overall cost and a better outcome, that's going to help me, whether it's for renewal or even my self-insured plan. And then engagement. If you're an employer right now, I think we know, and I can use MeMD as an example. We're looking at a benefit increase in price. It's really hard always to say to your employees, well, look, we got this cost, it's going up. We got to share the cost. How do you provide some benefits that help the employee? Well, providing one that's no cost at time of visit with prescription discounts that gives them access and transparency to the top docs for in-person referrals, that's going to help with employee engagement. The other thing is you don't lose the productivity when somebody has to go spend 2 hours or half a day going outside for a medical appointment. It can be done virtually in a much more convenient fashion. So overall, and I'll turn it back over here to Rob in a second, is we've really tried to put together a product that tackles these big issues. Healthcare costs continue to go up. There's no end in sight. That preferences are changing. And I think when we all look forward in about 2, 3, 4 years, the amount of care that is being consumed virtually, and for that matter, everything, is going to be significantly more even than it is today, 6 months into COVID. And ultimately, if we can change and kind of bend the cost curve while also improving care, then we're doing the right thing, and that feels good overall. And we're excited about that at MeMD. So with that, I'll turn it back over to Rob.
Thanks, Bill. And that pretty much wraps up the presentation portion of it today. We do have a few questions that have come through in the box, and I'll open that up to here in a second, but just wanted to sort of reiterate the relationship between TouchCare and MeMD. So we have been partnering with MeMD to bring telemedicine and virtual therapy services to our clients via TouchCare in a very integrated fashion for a couple of years now, and have experienced an awesome partnership working with the MeMD team, and really appreciate Bill and you and your team and Dr. Lorenzo and everybody being so helpful and for joining us today. We are really excited about the move into offering the virtual primary care solution to our clients as of starting January 1st. And so sort of been working in conjunction with the MeMD team on getting that offering out of the box and ready for delivery to our clients, but having those conversations now with many employers, which is great. I'm going to jump into some of the questions here real quick. We've got 4 or 5 that I want to try to get through. If Dr. Lorenzo and Bill, you can stay on here for a few more minutes with us. The first one here is for you guys. This is a brand new program. How do you think employees will adapt to using the virtual primary care offering?
Yeah, so this is Bill. I'll start with that one. Well, yeah, I think if COVID had not happened, I think it would be a little bit more of an uphill battle, even though we were already going that way. And because of COVID, it accelerated adoption. So I think people are ready for it. I think, it'll grow over the next several years. But when you give them a low cost or no cost to the employee, time saving, one-on-one relationship with a primary care physician to manage their care, it's hard not to see people experiencing it and then telling others, look, I don't want to consume medicine any other way. So adoption is already, the interest that we're having in virtual primary care is extremely high from a lot of our current clients as well as new ones. And we're excited about the partnership with TouchCare. It's just going to continue to grow. And for those, the the gig economy and the millennials and anybody's had a virtual visit, the response already is showing to be very favorable.
Yeah, and I just to piggyback on that, and add a little anecdotal personal experience to it, Bill. We consistently work with employers on strategies to help engage their employees as consumers in a better way with the healthcare system. And one interesting study that we did with one of our employer groups was we pulled out a subset of the population, and we broke it down by employees who had in the previous 24 months had a primary care visit and employees who had not. And with that specific employer, there was a close to $1,000 difference in healthcare consumption between the employees who engaged with primary care physicians and those who did not, just because those who were engaging were taking better care of themselves and catching illnesses earlier and more often and more compliant with their prescription drugs and things like that. And so, anecdotally speaking, just with my own experience, I mean, I am one of the few, it seems like, who still go get an annual physical every year with my doctor. And just recently I did it, and it took me a couple months to get an appointment. And I was thinking about, how much easier this could be if I could develop this relationship and have it virtually and have it done effectively virtually. And the barrier that sort of breaks down in terms of access and the desire to wait months and go through the back and forth through, the EHR to get things scheduled. And so, just anecdotally speaking, I think it's going to be really well adopted with folks, and just what we see at TouchCare, trying to drive primary care engagement amongst the employee populations that we work with as a means to create more healthy, more productive, more viable employees. I think giving them an easy option is a really great thing.
Yeah, so I think, I'm sorry, just to tell you that is if you just solve it from did we reduce costs and make it helpful for the employee? Yes. Are we removing the barrier of having to wait? Yes. Can we, in our use case, how about can we include labs to make that a no-brainer to go get their wellness labs? Yes, because everyone on this call, I'm sure, is aware that the higher percentage of employees you can get to do a annual wellness check and visit, the better you're going to identify conditions early, and the better you can control costs. And so that type of visit alone is essential, and removing those barriers will speed up and get more people to actually do it.
So I think that's a nice segue, Bill, too, into the next question, which is, can you describe how this works in conjunction with my current health plan?
Yeah, so it complements a current health plan exceptionally well. So if you think about it from the standpoint of, depending on the type of health plan it is, if you look at it from a cost standpoint, it helps out alone because it's a much lower cost alternative. As I alluded to earlier, if you're self-insured, it keeps claims out of the plan. If you're fully insured, it can help you control future renewal premiums and get those down. As well as when you are in a current plan, as I talked to with the intelligent referral component, is we know there's a percentage of care and that always will end up needing some sort of specialist. And when those cases, how do you find the best ones at the lower cost? We're able to work within whatever plan is in place, identify providers that are in that plan, and then be able to give patient options that have that high quality, best overall cost solution, which helps significantly for both types of plans, self-insured, fully insured, in terms of long-term costs along that way. So it complements it pretty well, since we can manage within that plan and really help members find the right people at the right time for what they need in their overall treatment plan.
And that actually leads nicely into our next question here. We've got a bunch coming in, so thank you, everybody. I'm going to try to get to all of them if I can. What? So I guess it's a two-part question. What does the quality of care look like for virtual primary care, and what types of conditions do you actually treat, or what can patients expect in terms of what types of conditions you treat?
So yeah, Dr. Nick Lorenzo here to answer that question. And this is a full primary care service. And there have been several studies done in the last year that estimate that anywhere from 50 to 70% of healthcare can be delivered virtually, including primary care. So what this product enables is that you can get the vast majority of your healthcare virtually, your primary care, and yet still have access to referrals for specialty care or laboratory work or diagnostic tests or imaging studies that are required to treat, for example, some chronic diseases like diabetes or asthma or heart disease. So you have the convenience of virtual care that can be accessed anywhere, and yet still have access to all of the other bricks and mortar tests and referrals that might be required to fully treat your condition. So the punchline is that this is a full service primary care offering. It's not primary care light. It's a full service primary care service that enables you to get the vast majority of your primary care services virtually.
All right, we've got time for a couple more here that are still coming in. The next question, actually, I'm going to try to combine two questions here in my answer too. So prior to COVID, embedded telemedicine plans in the insurance carriers utilization average, low to 3%. How are you going to approach member engagement to increase telemedicine utilization? And then there was another question about how does the partnership work between TouchCare and MeMD that came through. So I guess I can start with that one and then kick it over to Bill and Dr. Lorenzo. But from an engagement standpoint with telemedicine, we've actually found at TouchCare to be pretty effective at helping to increase that as a part of an employer strategy as well, just by driving awareness. And our touch points tend to be more broad because we're sort of dealing with the administrative side of healthcare and anything from benefit questions to open enrollment to bill review negotiation to helping you with a disability claim. And so all of those touch points are opportunities for us to also help the member or the employee ultimately get to the best point of care at the most convenient time and things like that. And so by driving awareness of the telemedicine program and working with MeMD on messaging and making it a really great member experience, we're able to drive meaningful utilization much higher than that 2 or 3% mark of the clients that we work with, just by sort of acting as that traffic cop and driving that messaging and making awareness and the touch points greater for the employee population. And then Bill and Dr. Lorenzo, I can flip it over to you guys as well, just on your thoughts on how MeMD specifically is going to approach member engagement to increase utilization.
Yeah, so maybe just to talk about the awareness, Robbie, you're exactly right. Awareness is the biggest component of people knowing they have the benefit. The second component is, do you make it really convenient for them to utilize that benefit? And then if we look at a little bit of the third thing is well, again, I hate to rely on COVID here a little bit too much, but here's what's happened now is, well, mental wellness is an important part of overall care. Well, now mental wellness, companies are more accepting, even though before in the past they'd say, sure, we support it. Employees never really got that feel. Employers are now more receptive to promoting and supporting mental wellness, and especially virtually, that can be done. So that helps drive engagement when we talk about overall utilization of telemedicine. And then when you add in virtual primary care, which which I'll argue is, the most critical, and it's about 50–60% of all visits that tend to occur can now be done virtually. You're rounding out the overall solution. So you have your historical urgent care only telemedicine, you have behavioral health now, and then you also have a virtual primary care. You really kind of have this complete solution where you can go with this virtual first orientation, and that will really drive adoption. Not without the awareness that Rob alluded to, and TouchCare does a great job of driving awareness, because when you have that awareness up, and then people say, oh wow, look at all this that I can do virtually, and then they actually experience it. And then once somebody experiences it, we all know that they basically say, hey, look, well, how do I get more of that? I mean, that was great. I didn't have to spend 2 hours in a waiting room or caught in traffic, or I can get a hold of them right now. Yeah, that will continue to increase adoption overall of telemedicine.
Absolutely.
And if I could add to that as well, so specifically toward the management of chronic disease, there are a significantly increased number of touch points between not just the provider, but the virtual primary care team that we have at MEMD and the patients, because communication is increased by text, by phone calls, by visits to the provider. That will significantly enhance the ability to better treat chronic diseases. And as we know, just to give one example, diabetes, if you keep those blood sugars under good control by having more communications with the patient, by making the patient feel they're part of a team that is trying to better control their blood sugars and the complications of diabetes, they're going to have much higher quality of care and patient satisfaction. They're going to say to themselves, wow, this is really neat that the virtual primary care service is reaching out to me. They're trying to help me. And if I need help virtually, or even in the case of a bricks and mortar visit, that they're there to make sure that I'm getting the highest quality care. And at the end of the day, as Bill mentioned, an ounce of prevention is worth a pound of cure, that putting a little bit of investment into prevention can significantly decrease the cost of managing chronic diseases in the long run. And so all of this really feeds well into the whole concept of virtual primary care and giving patients the care that they want as they want it.
Awesome. All right, we got one more question to get through, and this one should be relatively easy. So what size employer groups are you currently targeting for the virtual primary care?
Well, it works with all sizes, right? So it really, and this is a question back to TouchCare as well. So we work with groups, small groups, we work with large groups. It really depends again on the group and what they're trying to do. If they're self-insured, obviously they're trying to lower costs overall. If they're fully insured, they're thinking ahead and trying to figure out how to give not only a good benefit, but how do I start attacking and making a change in my continual escalation of healthcare premiums. So we work with it's all groups, and the MEMD customer base, which if you look at this, we have well over 5 million members at this point, and that represents companies of all different sizes.
Yeah, just to reiterate that and extend on that a little bit from the TouchCare standpoint as well. We get this question a lot from employers or broker partners who we're working with, and my answer to that is always find me a group who is unhappy with their healthcare costs and whose employees they want a better experience for, right? And so I think that that's absolutely right, Bill, and this is relevant for small groups, this is relevant for mid-market clients, this is relevant for enterprise employers, because the challenges that they're facing are all the same. And so as it relates to group size and target market, we want to work with employers who have an interest in improving the member experience and ultimately reducing their cost. And I think that wraps up the questions that we have here. So hopefully I got through everybody's. If I didn't answer your question, I had my contact information on the screen beforehand, and you should have received at least marketing emails from us on how to get in touch. And we look forward to hopefully having some conversations with all of you. And so thank you for joining us today. Yes, have a good one.
Thanks, everybody.
Thanks, everyone.